This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
And I'm a man.
Yes, you are. That matters. They don't know the title of this episode yet, so that might not make sense. You're just reaffirming yourself as a man. Indeed, you are.
Just want everyone to know that I'm a man.
Yes.
I can list my pronouns. I can do whatever we need to do
there you
here.
go. It's very
let the cat out of the bag.
Very masculine, Dr. Jason Martin. He's a board certified.
I don't know about that. I'd like to be more masculine, but I'm not.
Plastic and reconstructive surgeon. I actually once had a patient tell me that, and this was a patient who was had a little bit of a crush on you, and I've never told you this because I would never. Now I'm going to tell everybody that they thought you were so alpha, and I was like, yeah, but you are.
I wish I was more alpha. I can tell you that. It would make my life a lot easier.
But you are, though. And
I don't know.
That's just part of the. I mean, we've talked before on episodes where.
Well, I'm more alpha than not.
You're more alpha to a patient than you are to someone else.
Yeah, to regular people, I'm not at all. But I know some very alpha kind of people, male or female, it doesn't matter. And man, it's just interesting to see them work.
Oh yeah, I appreciate it.
It's very interesting. It's like, wow, this person's going to tell everyone what they think. And then they're going to do that. Well, but see, that's it's not even a discussion, That's not my MO.
It's the doing part, though, that makes somebody alpha.
Yeah.
I mean, that's just being bossy. Being bossy can be very
but
beta.
It's the second part.
All right, well, so we'll just start this one more time with the very alpha Dr. Jason
Very
Martin.
alpha.
He's a board-certified plastic and reconstructive surgeon.
Representing.
Dr. Martin, how you doing?
Good. I'm doing pretty good. So I wonder what topic we're doing today. First, I just want to tell everyone I'm a man.
Dr. Martin is a man?
Yeah, I am a man. So our topic today is facelifts for men.
For men.
Yeah.
Yes.
So this is a hot button issue. If you can believe it, is this crazy or what? That I actually do facelifts on men, and it's pretty common. Mm-hmm. So a lot of people listening to this, probably a majority are women, but there are men that listen to this, and there definitely will be men listening to this episode who are interested in facelifts, but are really confused, really nervous.
Yeah, worried.
Don't want to look weird. They're like, I can't believe I'm even looking this up right now. But something has to change. I have a real problem. My face, my neck doesn't represent who I am. Everything's changed a lot for genetics, past medical history, you name it. All the reasons that we age.
We'll talk about those.
Yeah, it happens to men too. I think it's funny sometimes in plastic surgery, people act like men are this strange thing that you would even consider doing, plastic surgery on. If you're a man and your eyelids hang over your eyeballs and you can't see, then you need a blepharoplasty.
Well, or if you have excess fat, you can get lipo too.
Right. There is nothing wrong with that. Men
get surgery.
We should have a patient bill of rights for men when it comes to plastic surgery. So hopefully this episode will help all men considering this procedure make that decision. This is going to be educational. This is not for marketing purposes. And, hopefully we can help you learn if you're a good candidate or not and why these surgeries actually are really, really helpful. And the patients tend to be very happy with the results.
Yeah. So first, if you are listening to this podcast and you would like to watch the slides and video that go along with it, you can find those on our YouTube channel at Jason Martin MD. So without further ado, let's just jump right in. So let's talk about first the differences in facial aging between men and women, because this is a key thing.
Huge.
So number one, let's start at the bottom. So the structure. So the bones and the muscles. Men have typically larger features.
Right.
Bigger head, more bone, more muscle.
A jawbone, for example. People as they age tend to not like their jawline and their neck. Women especially, because they get something called jowling, Jowling. Men usually have bigger mandibles, jawbones. So just like a house, just like a couch or anything, if you have more stuff to drape the skin over, then you're going to have less hanging soft tissue there. And that bone makes a big, big difference. As we age, the mandible, the jawbone loses its mass. That's called what, Amy? Osteoporosis. And that happens in osteopenia. And it happens in your jaws. It happens in, long bones, happens everywhere. And women are not fortunate to have prognathic kind of appearances or large jawed appearances. Now, there are men we see all the time that don't have real strong jaws, but most men do, at least in comparison to women.
Yeah. And even just the muscle mass, the same thing. Like men tend to carry more muscle, that it atrophies less quickly. Like a lot of that is that we've talked before about the SMAS that holds everything up. So that is also going to help keep everything just up where it should be for longer. It eventually starts to drop, but it's just there longer. Surface, skin and photo aging.
Now, this is the tale of two cities here. Okay. So when it comes to bones and muscles, it's great for men. When it comes to skin, that's where the wheels fall off. Men don't wear sunscreen.
What's that, Dr. Martin?
I know. They don't even put lotion on. And I'm not trying to stereotype men, but this is pretty much everyone. It doesn't matter what your persuasions are. Like every man, they don't seem to want to do the right things. They don't do lasers. They don't do IPLs. They don't use retinols. You name it. It's usually a real bad problem. Men usually have sun-beaten skin and bad wrinkles. They don't do Botox. They don't do fillers, etc. So,
well, the flip side of that, though, is that their skin tends to be thicker.
Very much. And that works in your favor overall.
Yeah, it's like, think of a curtain. If we're talking the curtain analogy, still like a really sheer, flowy curtain, or like a thick, like blackout shade. Like men's skin is more like a blackout shade. Like it's much thicker. It has a lot more structural integrity. And
that once you get wrinkles, male skin, once you in the kind of glabrous, oily, thick skin, once you get wrinkles, you're not getting rid of that with lasers like you can on like a real thin-skinned female facial wrinkles. When you do with like a laser, like a fractionated CO2 laser.
Yeah. Hormones and weight, women throughout the course of their lifetime, most women who are fortunate enough to get to have children might have severe weight fluctuations because of pregnancy. Also, they go through menopause, which causes a massive shift in hormones. All of those things affect the quality of the skin. And those are things that don't happen to men in the same degree. Your hormones stay a lot more stable throughout life. Most men's weight stays a lot more stable throughout life. So those things that kind of stretch the skin or cause the skin to lose elasticity through hormonal reasons don't tend to happen as to men.
With pregnancy, women can have fluctuations 70, 80 pounds.
Well, and just then the fluid and everything else.
And that's going to affect your face. Your face blows up and then comes down, up, down, and all that stretching, those kind of, and then even with their cycles, menstrual cycles, they'll get swelling, edema, and then it goes down. Men don't usually have that problem.
No, I don't know many men who menstruate. Have you? You're a man.
I feel like I menstruate. I work with all women all the time.
I'm going to bring you into my moon cycle.
Yeah, okay.
So medical treatments, that's where you were talking about with topical things, but I was meaning more like if you've had to go through like cancer treatment, those things drastically can increase the rate of aging.
Yeah. And, breast cancer, 1 in 7 women.
It's actually 1 in 5 now.
Yeah, it's crazy. And not most, but some of the time, they'll get chemotherapy depending on the type of cancer. It's disastrous. We've seen
even the estrogen blockers. I mean, those same thing can really
you get tamoxifen and all the things you take after breast cancer diagnosis and treatment for ER positive tumors or estrogen receptor positive tumors. All these things can be disastrous toward your looks, toward your appearance, your skin turnover, all the things that go along with that. So, and then men can obviously get cancers. They can get chemotherapy. I mean, all of us have known middle-aged men who have had some sort of cancer and probably chemotherapy, and that's really aging. It really can affect your appearance. So it's very common, men or women, for people to come in after cancer treatments because they want to look better. Think about how traumatic it is to go through a cancer treatment, to get that diagnosis at middle age, and then afterwards feel like you don't look like yourself, that you've aged, that you look bad, that you look tired, and you want something to improve it. So, I mean, it is empowering in that sense. I think those are some of our happiest patients because you really give them some joy.
And getting to have surgery for something they want versus something they have.
Exactly. I mean, it's something, it's just kind of getting through that hard time.
Yeah. So those are, some of the big differences that, you really can't affect. Like these are not lifestyle factors for the most part. I mean, the sun exposure is, but everything else, I mean, these are kind of things that just are differences between the way men and women age, and that affects things. So let's talk about this is, I feel like, the biggest slide here: social stigma and the gender gap. This is real.
Yeah.
100% this is real. Men are given more grace with aging. They just are.
Yeah.
That's societal. It's just what it is.
Which is a good thing, right? So someone like me, everyone's like, oh, he looks great. But do I? But the bar is down here. Whereas women, unfortunately, in our society, the bar is up here, and it's an unhealthy standard to put it up here.
Well, even the way we treat an older man versus an older woman, an older man is like seen as distinguished and
Right.
has a lot of experience, whereas an older woman is just seen as an old lady. It's like all their education, all their experience is kind of taken from them when their looks go.
But just because society may look at you a certain way, and then you look old, but you don't feel old.
Yeah.
But then the man is sitting there like, well, everyone's telling me I'm looking good. This is like, I'm respected. Well, that is kind of a bad situation too, because those same men come in here and we have the same conversation, which is borderline annoying. They're like, I don't know why I'm here. This is stupid. Why am I doing this? Why do I feel this way?
That's most of our men.
No, it's a lot of them. Like, you're not there. See, for once, I have the personal conversations. You have all the conversations with our female patients. I'm having a real conversation with them, and I agree with them. They're like, man, why? This makes me feel kind of dumb to be in here. Well, they feel that way in some ways because society is telling them, well, you're okay. You look good,
Well, or they don't know anyone else. That goes down to the first rule of Facelift Club is you do not talk about Facelift Club.
No, you do not.
Your guy friends are not talking about their facelift.
Bro, that facelift I did the other week, awesome.
Right. So I feel like men feel very isolated.
Are you gonna use a driver? Or are you gonna
Right. But they feel isolated in their desire for surgery because they don't have a bunch of guy friends who have gone and gotten surgery before them. Yeah. Whereas most women, maybe their mom even had a facelift or their aunt, somebody they know has had a facelift. Yeah. Whereas with most men, even if they do know people who've had facelifts, they don't know they know that.
They're not going to talk about it.
Right. They don't know they know that. So I think that's part of that with men doubting why they're here is just because they think they're alone. They think they're an island. Was it Bon Jovi? No man is an island, right? Yeah.
I think it was Dead or Alive was a Bon Jovi.
Yeah. Facelift Club for men is definitely, they don't talk about it. Like,
men don't talk about cosmetic surgery if they've had it.
Not to their other guy friends.
No, never. Maybe the eyelids, but probably not. And it's so obvious when someone has really heavy eyelids and then the skin's gone. And it's a great surgery, by the way. It doesn't look weird afterwards, but it's obvious there's a difference and they still don't talk about it. I think the fear of looking weird is universal for most men that come in. And these are men that are of normal people that just want to look better, but they really haven't done a lot of stuff, right? Well,
and the same reason about Facelift Club, for men, the only examples of plastic surgery, at least that they think are out there, are bad. No one looks at a good-looking guy who's 80 and thinks like, wow, that guy must have had a facelift. They just think like, wow, that guy just aged gracefully. Whereas you see an 80-year-old woman who looks great and she's had at least 2 or 3 facelifts.
Right.
So for the fear of looking weird comes from men only being mirrored cosmetic surgery in men that's awful. So they assume that that's the only outcome.
Right. So people in my age group would think of Kenny Rogers or somebody like that.
I think I actually put that on the slide.
R.I.P. Like I'm not throwing shade. Yeah. That kind of thing, and like a Wayne Newton type or something. So again, nothing wrong with those people. Kudos to you. But I think that's hard to kind of see yourself. Like, what's the expectations? Like, is that the only thing that's out there?
Right.
Is there an alternative for me? Is there natural results? Can I still look like a man, or the way God or nature made me, et cetera, et cetera? And these are really, really valid questions, to be honest with you. And I joke around a lot with my male patients, but this is at the heart of, I fully understand that, because there is no examples.
It's not like Sean Connery was out there saying like, yeah, I've had a facelift.
Right. No one's ever talked about it, ever. Not
Whereas
one time.
Women talk about it all the time.
Right.
Like, it is part of the conversation for any woman over the age of 35.
So, it's like, and that's kind of a man thing. Men don't talk about ED. It's not like you're not out and like your friend says, I have erectile dysfunction, right? Where women may talk about certain things like that. They don't talk about what it feels like to age. They don't talk about what it feels like to have fat where you don't want it, even though you're working out as hard as you can because you've aged. Your mid 40s and mid 50s. I mean, these things are real and it's like universal with a lot of men, but they just don't talk about it. And then you're stuck with your mind. You have nothing on the internet to really show you real examples. There's not a lot of educational stuff on the internet, hence the reason we're doing this episode. And then you feel like this is dumb. Like, why am I even considering this?
Right, because you feel like you're alone.
Then you go to the dermatologist. And then they try to get you all those Botox and fillers.
No, don't do that.
Yeah.
You want to look weird in a hurry. Do a lot of filler.
And that's fool's gold too, and then they get demoralized. And I've seen that too, where they come in and they're like, man, I did Botox a couple times, fillers, and I felt stupid doing it. So I don't know why I keep saying stupid, but it's that feeling of like, not shame, but
so you feel like you're alone.
You feel
like you're on an island all by yourself.
You're kind of isolated in this decision-making progress. Usually the significant other is very helpful.
If they have one. A lot of our male patients are single.
Yep. So.
Yeah. And timing, I think this is really key. Timing may be even more important for men because that aging process happens more slowly for most men. You have a shorter window. For women, I mean, we could do a facelift on a woman when she's 42 and she knows that she'll have several more facelifts coming up because that's just life. So it's not like you were like, oh, maybe wait a couple of years because then you can just do it once. Whereas with men, they probably will only have 2 face and neck lifts in their lifetime, even if they, starting kind of appropriately. So eyelids, all those kinds of things, I think for men who are considering surgery, like
you said eyelids and I started scratching my eyelid.
Pavlov's dog over there.
That's crazy.
So, just understanding that timing is really key. So thinking about this earlier rather than later, making sure you understand like where you're at with your aging and what options are available, I think is really key for men.
Cool.
Yeah. So what are some of the options? I think that this is a question I get all the time when I tell people what I do, and then they're shocked that men do facelifts. I'm like, well, there's lots of options for men to do facelifts.
So we have multiple episodes on facelifts, on neck lifts, on direct excision neck lift.
And never once do we say that those are only surgeries for women. But
right. So they're for everyone.
Yes, they're for everyone.
It's universal. We're like,
thigh lifts, even tummy tucks for all people.
Besides, pretty much every surgery we do can be done on a man or a woman, right? Even breast augmentation. So face and neck lifts, you can have a full, you can have a mini, you can have a modified or a direct excision. A full encompasses the entire face and the entire neck. A mini is mostly the face, a little bit of the neck. A modified, I guess that would be kind of a closed neck. That's like
or if we do like an open neck and a mini face.
Yeah. That's modified. It's just kind of that middle option. And a direct excision neck lift is actually excising skin down underneath your chin just to get rid of the waddle underneath your chin.
And we have an episode all about that.
We have an episode on that, and you can look on our Instagram account, Jason Martin MD, to see one of the posts we did. It has a video on that. So actually, you can look at our YouTube channel too. So there's different types of face and neck lifts. Again, go back and watch our episodes on these. We don't have to belabor the point, but
to find out like the details about them.
No matter what, whatever you present with as a man, you can do almost any of these options.
Even for men that are completely bald.
Yes, that's true too.
Yeah. And I think that's probably the more surprising thing. Like people think that they can't have it because they have like thinning hair or because of the way their hair is cut, and it would, you absolutely can.
And the reason that is for a majority of these surgeries, the full is a little bit different, but you can do something called an omega lift, but you can do almost all the incisions around the ear, and the ear is a perfect place to hide those scars.
And they fade.
Yeah, and they fade.
I mean, they really do. They fade and they heal. I always say that the only people that will ever know you had a facelift is your esthetician and your hairdresser, and even then, only if they're looking. So they fade, and especially for men, because your skin heals better too. One more thing in the checkbox of like why a man should have a facelift, your skin heals
tend to heal really well.
Yeah. All right, let's take a quick break. Get a word from our sponsor. Let's get checked. Like you get your testosterone levels checked.
Yeah, we got to get it.
Yeah,
we got to check for this low T. We got to get that fixed.
Yeah, we'll be back. Dr. Martin, I'm super excited to talk about our sponsor for this podcast. Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and it's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically, you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where two of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC. So TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
And we're back. All right. So let's jump into this a little bit more. Let's talk about some of the youthful add-ons. And I called this youthful add-ons because I think, again, like you said, men may feel kind of out there, right, in a sea of loneliness thinking about a facelift. But what are some other things that can really help make some of those general like youthful improvements? And these could be done with or without a facelift. So
for sure, the first thing that comes to my mind, which I did today, is an eyelid surgery. I mean, it's almost universal of most men, especially fairer skinned men. Will need eyelid surgery at some point in their life. I need it at some point, and probably in the near future. So that's a surgery that you can do. You will not look different. You just clean yourself up. You look less tired, less aged.
Can see better.
Yeah, you can actually see better.
Get your peripheral vision back.
That, I think 100% eyelids is probably the first go-to, and that's going to be a majority of men. The second thing I would think is injectables along with that, which would be Botox. It's Botox. We have a great episode on Botox. It's not like transformative.
Did you see in the news that there's actually some farm that has a botulinum outbreak in their red peppers? So they recalled a bunch of red peppers for botulism. Yeah.
That's crazy.
I know. So just since we were talking about that.
Listen to the Botox episode.
It was not in ham, surprisingly enough, or cured meats. Yeah.
So Botox is great. Fillers less so in men because they tend to have more volume, and like over-injecting volume in men, it looks weird. I think
weird in women too.
Yeah, that's the thing. And then the third thing would be brow lift for sure. Men tend to have heavier brows. If you could see a picture of Nils right now, our producer.
He just has really muscular brows.
He's very Nordic.
That's what's going on. You can see his labella from here.
His brow and eyelid are just fused into one unit. So it is true. So, and it's bushy, very thick. So I think a brow lift is good. The brow lifts, there's two ways to do those. You can do an incision on the hairline or incision like back in the hair. Men that have receding hairlines, the incision on the hairline tends to not work as well. So it just depends on what your hair pattern is. If you have male pattern baldness, it may not be an option. From there, earlobe reductions, I think, Amy, would probably be what you could see. Definitely the noses, ears tend to change with age. Rhinoplasties are really helpful for men, but they're less common. We've mentioned this before in the rhinoplasty episode. The male rhinoplasty is the red flag surgery.
The revision male rhinoplasty. That's the red flag.
Because usually that means that the person has higher risk for body dysmorphia. But in general, if you take the standard male patient who has had fractures of his nose or problems with his nose, I think the rhinoplasties work well.
The earlobe reduction is good for people who had piercings.
Oh yeah.
A lot of guys.
For sure, those gauges.
Yeah, that's more of an earlobe reconstruction. That's actually really hard to do.
The funny thing on here, the number 6 of 6 is probably should be number 1 is skin resurfacing. And men should do that more. I don't think they do it as much, but it's getting a lot more common now and really can make a big, big difference in the way you look.
I think the hard part with skin resurfacing for men is that men don't tend to see the long game as much with skincare. And I think that's why most men don't follow through on skincare or continue, because it's not instant gratification. Like you might have some skin resurfacing done, like, yeah, you're freakishly red and you were uncomfortable for a few days or even a week. And you're like, well, that didn't really do anything, because one may not be enough. Like it's more about maintenance. So I think that's more getting into the habit of doing these things and knowing that they are doing something, even if, and again, guys tend to be very visually driven. So like if you didn't see the difference from one treatment, like, oh, well, that didn't work. So knowing that some of these things are the long game.
It's true. Yeah, it's true.
But they do work.
I'm forcing myself to do retinol now for that reason.
That's right. And your skin looks better.
Yeah, it is. It does.
Yes. That's part of the being hydrated is part of it too. But, specifically for men, and this is where like with timing, if you're going to be going under the knife or having surgery, trying to do some other things that are going to help with that youthful appearance without making you look weird. These are some great add-ons.
Yep.
None of these things will make you look weird. Injectables may be the one caveat if you're doing a lot of filler with someone who, maybe just
wants to have you spend money.
Yes, charge you $6,000 on filler because they're going to give you a liquid
Just
facelift. Just go away.
Yeah.
Yep. So who's a candidate?
Okay, so first and foremost, again, go back to all the episodes we've done on this. Every one of them is really good. But first and foremost, it's somebody that presents with age-related issues of the face and neck. The foundation is loose skin, wrinkles.
Muscle laxity,
perioral aging around the mouth, marionette lines that go down from the edge of your mouth to the chin, jowling. That's more common in women, but you see that in men. Men really have the neck problems. Loose skin on the neck underneath the chin, fat on the neck. So they just really have lost that youthful contour, which would be a nice demarcation along the jawline and a really tight neck. Men, like women, lose volume in the face. So resetting the foundation of the face can really make a difference there. And then you add in the add-on things, specifically the eyelids. That's really makes a difference. So it's somebody who has, the typical presentation of aging of the face and neck, and also included with that, I would just say eyelids too.
Yep. Yeah.
They have to be healthy enough for surgery. Men are so funny too, because women I don't know what it is about being like proponents for their health. Women tend to be better. Men are like, I'm fine. And then you get into it and they're like, oh, I'm on 3 high blood pressure medications.
I have a pacemaker.
Or I have a pacemaker. I'm like, I take asprin every day because I had a heart problem or something. Yeah. I'm like, well, that doesn't really bode well for elective surgery, does it, John Doe? But I think that, as long as you're healthy, you live an active lifestyle, non-smoking, no diabetes. And if you have diabetes and you want to do this surgery, your hemoglobin A1C has to be around 6. Somewhere around there, and you probably should get preoperative clearance, and that you have a stable home environment that someone can help you with recovery. I think that you're probably going to be a candidate for this if you present at middle age with aging problems.
Yeah. Controlled blood pressure too. That's a big one.
That's a big thing for actually high blood pressure is really problematic with a facelift. If you have a high blood pressure, and what does that mean? Diastolic blood pressure 140 or greater, somewhere in that. Or systolic blood pressure 140 or greater.
Yes, if your diastolic is 140 or greater, like you got some problems.
That's okay.
Yeah. Like you are in the ER.
I've felt that way a few times with my kids.
210 over 140.
I think my brain is going to explode. But, a systolic greater than 140, a diastolic greater than 90 on a regular basis. It's, if you're on multiple high blood pressure medications, you're going to be at much higher risk for bleeding after a face and neck lift. So your blood pressure has to be under control for this surgery.
Yeah. So let's talk about some frequently asked questions. And we, again, cover a lot of what to expect on our other podcasts, but
yeah, so we're being a little bit vague here, but again, we have amazing episodes on face and neck lifts.
That really deep dive into it. I think the number one, do men really get facelifts? We get asked this all the time. I would say this is the most common question I get in the world at large.
I can tell you they do because I do them.
Yes. They absolutely do.
I literally do them.
Yes.
And they're men.
Like, you are not alone. You are not an island of
Yeah.
one. Like, men get facelifts and neck lifts just like women do, and they look great and they look like themselves. And the reason you don't know is because they look good and they look like themselves. Like we say in our facelift episode, the best facelift is the one that no one notices.
So, you know that app called Cameo where like semi-famous people, you can do a video and you pay
we
for
should
it?
get on Cameo. You think people would pay
But
us?
I would only do a Cameo for men who are worried about doing a facelift, just a pep talk.
Like a pre-op pep talk.
You could do this, man.
Like, other men
You're
have had
worth it.
facelifts.
You're gonna look awesome.
You're going to look like yourself. Yes. They don't want to look like Kenny Rogers.
No.
Right? How what are you going to do? Like, if I can't look like Kenny Rogers, like, how are you going to keep me from looking like that? Here's the secret to all of this. You are going to look like yourself.
Yeah. So a male facelift in neck lift, the secret is hit it right in the middle. You know,
Not too tight.
not too tight, not loose, right in the middle. Goldilocks, economy plus. Okay, just that thing. You know.
Medium firm.
Yeah, exactly. Medium rare.
Rare.
So like you just want to hit it right in the middle. And the neck, you have a little more leeway. You can be stronger on the neck, and I usually do the neck pretty tight. But other than that, when it gets on the face, right in the middle. Don't pull too tight. Not too much volume. Make sure those incisions are well hidden, okay? And that in totality is the biggest difference for men. If you do that, limit the number of surgeries you're doing, and really scope in the work, you're going to be just fine. You're going to look like yourself and be really happy with the results.
Well, that's the question. Will I look like myself? Will anyone know I've had surgery?
At least in our office and offices like ours, you will 100% look like yourself. Guaranteed.
And will anyone know you've had surgery? Like,
Right.
only the people you tell. You know, that really, and that's true even of a surgery, even of like an obvious surgery on someone. You know, people don't look at us the way we think they do. And they don't necessarily jump to that surgery.
Or they really don't even look at us.
That's what I mean. They aren't even looking. Like, unless you look horribly odd, which would be unlikely if you go to a board certified plastic surgeon, no one's going to know you had surgery unless you tell them.
Yep.
Yeah. The big one, especially for men. When can I be back to work? Let's fill that in with like whatever thing that I've told them they can't do for 2 weeks that they already did the day before.
Forget about work. It's always like, I got to go, blah,
I already
blah,
did that. I'm going on a deep sea fishing expedition. I'm going to be scuba diving at 150 feet.
Yeah, I mean, because let's be honest, the men that are getting face and neck lifts tend to either be retired or, I mean, we have working ones too, but like, a lot of them they have free time.
Well, or they really want to look good. Like, it's important to them to keep looking good. So they also are doing things that,
Right. They have
they
very
do other
full
things.
lives.
Yes. Other fun things.
And apparently they want me to rearrange my OR schedule so they can go tarpon fishing in Mexico or something.
The next day.
And I was like, no. So, a couple weeks to get back at it, at least think in your mind 2 to 3 weeks at least. And that's not even exertion, like real exertion, lifting weights, elevated blood pressure, elevated heart rate. That's 3 to 4 weeks. You can have swelling and bruising for the first week or two for sure. You're not going to want to go outside. You're going to have social awareness of the way you look for at least a couple weeks. So you just got to take it easy.
But it goes fast. And that's the other thing I always tell people. It's 2 weeks after surgery before you know it. Like, It seems like a long time going in, but it really goes by quickly. And we go into a lot more detail about the specifics of downtime and recovery in some of our What to Expect podcasts, and then also the specifics on facelifts. But it goes fast. And in some cases, I mean, we have a lot of male patients who work from remotely, who are high up in companies who can work remotely. You can be back to working remotely in a
couple
day or two.
days. Yeah, you can be doing emails the next day as long as you're off pain
Phone
medication.
calls, that kind of thing. You can.
By the way, it's not a super painful recovery. The first day or two can be tough.
It's tight.
It definitely feels tight. You have to sleep with your head elevated. You really can't sleep on your side, which would drive me crazy. So, there is that component, but in terms of walking around, doing like normal activities, you can be pretty good.
You're eating, you're drinking, you're doing normal things. Yeah. All right. I think we covered it. Dr. Martin, you're a man.
Yeah.
Do you have any questions for me about
established I'm a
facelifts?
man.
Yeah.
What'd you say?
Do you have any questions?
Well, I think that, for men, the one thing I would like for men is for them to have real information and also feel empowered, no matter what society feels, good or bad, that they can kind of create the path they want in their life.
Mm-hmm.
If you were in your 40s or 50s or 60s or 70s or 80s and healthy, and you have age-related changes. By the way, we've done a direct excision neck lift on an 85-year-old who still works.
83.
85 in my book.
Well, he's 85 now. It was
Okay.
2 years ago. So yes.
Yeah. you have options. You don't have to feel like you look not your age.
And you're not alone.
You're not alone.
Yeah, men walking down the street that you see have had facelifts.
Yeah. It's
The
more
normal
common
looking
than
ones.
you think.
Yes.
We have a very normal practice full of fun and eccentric patients, but they're fairly normal and it's natural.
Yeah,
It's
they
a
have
natural.
jobs, they're dads.
They're natural aesthetics.
yeah.
They're not they don't want people to know what they're doing. They're not doing these surgeries so they can show other people. They just want to feel a little bit better. Okay. And we have a crap load of men that come into our office from all walks of life, from all interests, through different professions, different races, and everything. I mean, and it's universal. Like the aging process is difficult. And why do I know that? Because Amy and I are going through it right as we speak.
Yep.
So we understand, we feel what you're saying, but there are options, and you will not look weird. You will look like yourself. And it's pretty amazing, some of the transformations we have.
Yeah.
But the baseline, it's not life-changing. It's not like winning the lottery. So you're just going to make these things that bother you go away. And so you can check that box and then feel a little bit better, and
feel
get
more
back,
like
get back to all the fun stuff you're doing in your life and enjoying middle age, or late age.
Late age?
I don't know
I
what's
like that.
later age.
Later ager?
I don't know. It's weird because like the transition from like middle age to advanced age,
Yeah.
it's like getting more and more. Like I would say someone who's in their 60s is still technically middle age, but I'm sure that's more advanced.
Yeah, it's got that advanced age,
Yeah,
unfortunately.
but it feels middle age.
Well, I think it's the closer you get to that age that you're like, well, that's not that
I
old.
know. When I'm 80, I'll be like, I think it's 100
Like, I'm pretty sure I'm middle-aged. I'm
Yeah.
60. Yeah. Like,
with all my senolytics.
85? Yeah.
Yeah.
Well, you just got to live longer then. All right. So I hope that was helpful. We really do love your comments. Some of our male listeners ask the greatest questions.
Oh, they do.
Like, we get great questions from our male listeners. So
I'm still stuck on the one that I think was a.
Dave.
Yep.
Yeah, he's not a medical school student. Poor Dave.
Still doing.
Yeah, he is
At some
not.
point, I'm just going to hire a private investigator.
Find.
Well,
Yeah,
is your name Dave?
He's never going to comment on one of our
Have
videos
you ever
again.
responded to a podcast? Yeah.
But if you do have questions, please leave us a comment, a like, a rating, a review. Share us with your friends, your male friends who you think need a neck lift or need their earlobes reduced. Share this podcast so that they know that they are not alone.
Or eyelids. They all need their eyelids.
They're not alone.
Yeah.
Yes. You can find us on social media at all of these fabulous social media handles right here. You can also leave us a voicemail at 303-630-9038. I do listen to your voicemails. I love them. And it really does help us when you guys interact with the podcast. It helps more people find us. And we really do appreciate it because we want to do stuff that's helpful.
Let's do it.
Will be helpful. All right. Thanks so much, everyone, for listening and watching today. We'll see you next time.
We got you, man. We got you.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.